Welcome back to the Next Gen online video tutorial series. In our previous video, we went over the different ways to access this assessment and plan template. If after the physical exam, you can go ahead and drop this down and enter any one of these tabs, or you have your quick link here. Under checkout, you'll also have the quick link, and under finalize, if you wanted to add in a last minute diagnosis, it would also get you into this tab as well. So briefly, under the assessments is where we learned how to add in new assessments and mark them as chronic or add them to your favorites. Under my plan, the main takeaway here was a cheat sheet for quick labs that are pre-populated and that this is the only place to do a follow-up visit. We'll get into the referrals tab and how this was strictly just for in-house referrals where you don't need a lot of information. AP details, highlight your diagnosis, and get to work on putting in your impression and patient plan. And now finally we'll get into the labs tab here. And really the main takeaways is just this is more expansive of a generic list of labs here. In order to actually order a lab, you highlight your diagnosis, go ahead and select these two, for example, place your order, and you'll see it generate down below. The difference between the My Plan labs and this labs module here is this is where you can start specifying fasting. It's also easier to kind of change up the time frame here for each lab. You could have done that in My Plan here by say we wanted that BMP to be done instead of today in 1 week. We could have changed it here as well, but as you can see, you can't specify if you want the patient to fast or not. That's only under the labs tab here. And then I'd just like to quickly point out the different blue tabs here. Mainly if you enter in microbiology, then you'll find a list of cultures that fall under microbiology, so it's really just titles for specific labs. And the most important one to probably know is this other tests. Once you open up other tests, you want to go ahead and highlight your diagnosis, jump into description, and then it brings you into the whole main frame of labs that NextGen has to offer, and as you can see, it's pretty expansive. Instead of scrolling your way through, you could just click in here and do the first letter of the lab that you want, and that'll kind of get you to the R's, for example. So we'll go ahead and order this rabbit serum protein. We can change the time frame if we want here, but I'd just like you to notice that I just did save and close, and we can see that our lab wasn't actually added, so that means we have to come back into other tests. We'd have to highlight our diagnosis, and then we need a place order. This screen pops up, go ahead, exit out or cancel out, and now we noticed our lab disappeared. That means we captured it. We go ahead, save and close, and we see it down below here. And that's really the whole labs tab. It's just more expansive, and then it gives you access to other tests. The fasting option is pretty easy to change up time frames here. So we'll go ahead and move into diagnostics. Diagnostics is really just where you're going to start to order all of your imaging studies. So as a quick example, we'll go ahead and just order a chest x-ray for the asthma diagnosis. Come here to x-ray body, and we notice that there's a bunch of different codes for the same thing, chest x-ray. They actually do pertain to different views, so a 1 view, a 2 view, whatever the case may be. I know from experience that this 2.0 codes the 2 view chest x-ray. We have lists in the charting rooms telling you what each code means. So now we've selected OK. We see it populate in our middle area here, but really we want our diagnostic study to appear down below. This is just one I did from before, so we'll go ahead and add in this more recent one. This once again pops up, just exit out of it, and now we see we have our new chest x-ray ordered here. So I actually would like to quickly show you, let's just say for example that we wanted to delete some labs that we had ordered, so we see that the rabbit serum protein was a duplicate. You can go ahead and highlight it, then right click. It allows you to delete labs directly from here just by right clicking after highlighting. And then Same thing with diagnostics. You go ahead, highlight it, you can right click and delete that diagnostic study. So now we only have one chest x-ray. And then quickly, you have access to your CT scans here, mammograms, ultrasounds, etc. So we'll go ahead and move on to referrals now. And as we discussed from before, under my plan, that's more of the bare bones referral where you don't need a lot of patient information and we're going to do it in-house. However, if we're trying to do any, I'd say, outhouse referrals, so we want to actually refer our patient to a cardiologist, for example, or actually since we use the asthma diagnosis, we'll refer them to a pulmonologist. How I like to teach this referrals tab here is it's a 6-step process and sometimes 7 if you want to add in any attachments, but that's not always the case. So let's go over the first step, and that's just marking 2. That then allows us to put in the actual specialty, which is the second step. We'll come down to pulmonology, select it, OK. And now we have to associate our diagnosis to that specialty. So as we said, it was asthma. And I'd just like to point out, if you didn't add in any assessments yet, then this whole screen would be blank, and it would force you to add in an assessment before you can do a referral. So that was 1, 2, 3, 4 steps. Going to be services requested, marking evaluate and treat, or consult. Those are really the most popular ones. And then you go ahead and skip over clinical indications and just jump right into step 5, clinical information comments. And I'm really just going to do a little blur, but that's where you would put in your comments. And then this step here, attachments, not always used, but if you did want to tell the coordinator to attach any chest x-rays or any labs that you want the cardiologist to have, you go ahead and type that out. Please attach chest x-ray, and they'll do that when they refer the patient during the discharge. And now, the most important button to press, but is often the most neglected, is this add button. If we don't hit add, for example, and we just save and close, then we're going to have to do all of these steps all over again. Really, what you want to see is all this information populate under referrals ordered this encounter. So we'll go ahead, select add. Once again, just cancel out of there, and now we see our pulmonology referral. Once again, we did the refer to Edelman in the last video under my plan, but we don't want it now. And in order to delete a referral, it actually doesn't let you right click and delete. So you would have to highlight it, select edit, come here to canceled, then save and close, and now we've deleted our referral. So I'll briefly go over office procedures, and I'll just skip cosign orders. I believe that's just reserved for MAs, and I really never see anyone using it. But under office procedures, there's a lot of duplicates here of stuff we can order under standing orders. I'd actually like to just say FS glucose down to guaiac card and PKU. All of these point of care tests are actually just in office procedures. So that's where you would come to find these tests here. But KOH slide and from PPD down to UA dipstick, these are also found in standing orders. So that's kind of up to your preference if you want to get in the habit of ordering your rapid strep here under office procedures or doing it under standing orders. Just keep in mind, from FS glucose to guaiac card and PKU, those are exclusive to office procedures. And I guess I can go ahead and say that we'll just do a brief recap of labs, diagnostics, and referrals. Labs was just more expansive labs to choose from. Remember other tests, and remember that you can designate faster, not here. Diagnostics, this is where you come to order your imaging studies. Just remember to highlight your diagnosis and go ahead and get into one of these blue tabs and order your study by hitting place order. Referrals, 6-step process, sometimes 7 steps if you want to add an attachment. always save hitting add for very last, and you want to see your information captured down below here. And that concludes today's video. We've officially completed how to navigate our way through the assessment and plan module. And thank you very much for your time. Bye.